Prostate cancer is a disease in which cells in the prostate gland, a walnut-sized tissue that surrounds the urethra just below the bladder in males, become uncontrollably large. Adenocarcinomas, which grow from the gland cells that produce the prostate fluid that is added to the sperm, account for nearly all prostate malignancies. Small cell carcinomas, tumors of the neuroendocrine system, transitional cell carcinomas, and sarcomas are among the cancers that can develop in the prostate, but they are uncommon. This form of cancer is very common in men, especially those over 50, and it is the second highest cause of cancer death in men in the United States. Furthermore, while prostate cancer is responsible for 10% of cancer-related deaths in men, 98% of men diagnosed with the disease live for at least 5 years. 84% live for at least 10 years, and 56% live for at least 15 years. Prostate cancer is caused by a number of unknown reasons. Male androgen hormones, particularly testosterone, and its metabolites appear to be connected to aberrant cell signaling in many cases of the disease. Testosterone can be converted to estradiol or dihydrotestosterone, which are both active substances within certain tissues. Prostate cancer cells are protected from programmed death called apoptosis by dihydrotestosterone, whereas estradiol encourages their growth. Testosterone appears to serve a critical function in maintaining prostate cells and activating death when abnormal cells arise.
What are the risk factors or causes of prostate cancer? One example of a modifiable risk factor is obesity. Obese people may have a higher risk of prostate cancer than people who are regarded to be of normal weight. Similarly, they are more likely to have cancer that is more aggressive and that returns after therapy. Secondly, an individual's diet and lifestyle may also be considered as a risk factor, since studies have shown that the risk of prostate cancer is greater in men whose diet contains excessive amounts of red meat or dairy products that are high in fat. With this, it may increase the disease's aggressiveness, resulting in more severe clinical symptoms in a more severe prostate cancer. Next, we have non-modifiable risk factors, which include both biological and environmental aspects like family history, age, race or ethnicity, and endogenous hormones. Men with a prostate cancer-affected relative are twice as likely to have the disease, and those with 2 or more relatives are roughly 4 times as likely. If the affected family members were diagnosed before the age of 65, the risk is much higher. Increasing age is also a risk factor, especially after the age of 50, and more than 70% of prostate cancer cases occur in males over the age of 65. Race or ethnicity is also considered as a risk factor because prostate cancer is more common in African Americans than in other races. It was shown that prostate cancer is more likely to be aggressive or advanced in black men. This is maybe due to the fact that African American men are more likely to be exposed to higher levels of testosterone from the beginning as a result of diet-related hormonal influences. Lastly, endogenous hormones including androgens and estrogen may also play a role in prostate cancer development.
For the signs and symptoms, early stage of prostate cancer is asymptomatic, while for the advanced stage of prostate cancer, it varies from how the cancer has metastasized. For the metastasis to the seminal vesicles and the bladder, the patient might feel dysuria, urine frequency, hematuria, painful ejaculation, and sexual dysfunction. For the metastasis to the lymphatics that causes lymphadenopathy, the patient might experience weight loss, weariness, nausea, and oliguria. For the metastasis to the bone via neurovascular bundle that contains vertebral venous flow and perineal spread, the patient might feel pathologic fracture, back and hip pain, neurologic deficiency, and anemia.
For the preventive measures, men who are predisposed to prostate cancer can minimize the risk by incorporating the following healthy diets and lifestyle habits. One of this is by choosing a healthy diet by doing the following. First is to reduce fat intake. Foods that contain fats include meats, nuts, oils, and dairy products such as milk and cheese. Reduce the amount of fat you add to foods when cooking, select cleaner cuts of meat, and choose low-fat or reduced-fat dairy products. Similarly, increasing intake of fruits and vegetables can also help. You might consider increasing the amount of fruits and vegetables you eat each day by adding an additional serving of a fruit or vegetable to each meal. Next is to add soy and green tea to your diet. Clinical trials have revealed that soy may lower prostate-specific antigen levels, while green tea has been shown to aid men who are at high risk for prostate cancer to reduce their risk. Another thing is to avoid eating burnt meat. Charred meat from high-temperature frying or grilling may produce a chemical component that causes cancer. Another preventive measure is to increase your vitamin D intake. Foods like cod liver oil, wild salmon, and dried shiitake mushrooms are all high in vitamin D. Many doctors also recommend obtaining 10 minutes of sun exposure every day since the sun is a better, more easily available source of vitamin D. Next is to keep a healthy body weight and stop smoking because both of these can help in avoiding cancer and a variety of other health issues. Next, an individual must also exercise on a regular basis as this can lower inflammation, boost immunological function, and combat some of the negative health effects of a sedentary lifestyle, which can help avoid cancer. Lastly, consult your doctor about your risk. Some points to discuss include what medical screening tests you should have as you age, your family history of cancer, and the dietary recommendations.
For the treatment, we have surgery. Under surgery, we have radical prostatectomy. It is a procedure to remove the prostate, the surrounding tissue, and the seminal vesicles. For the pelvic lymphadenectomy, it is a surgical procedure to remove the lymph nodes in the pelvis. For the transurethral resection of the prostate, or TURP, it is a surgical procedure to remove the tissue from the prostate using a resectoscope. For radiation therapy, it is a cancer treatment that uses high-energy X-rays or other types of radiation to kill cancer cells or to keep them from growing. For radiopharmaceutical therapy, it uses radioactive substance to treat cancer. For example, alpha-emitter radiation therapy that uses radioactive substance to treat prostate cancer that has spread to the bone. Chemotherapy is a cancer treatment that uses drug to stop the growth of the cancer cells. It is either by killing the cells or stopping them from dividing. For the immunotherapy, it is a treatment that uses the patient's immune system to fight the cancer. Substances made by the body or made in the laboratory are used to boost, direct, or restore the body's natural defense against the cancer. For the targeted therapy, it is a type of treatment that uses the drugs or other substances to identify and attack specific cancer cells. Targeted therapies usually cause less harm to normal cells than chemotherapy or radiation therapy do.